When we talk about team-based care in a medical home, we often make the mistake of thinking the team is only those people who work inside the four walls of our practice setting. And in fact, that's a good core start. But no matter whether you're in a large multi-specialty integrated delivery system with a lot of human resources, or you're a solo practitioner and you have one or two people supporting you, either end of that spectrum, we have to think of team as not just the folks inside our office, but also everyone else we interact with in delivering that universe of goods and services to our patients that may be in the community, in the medical village and medical neighborhood of supporting our medical home. So there are other folks inside our health system. They're drilling down into our community. We start with the big health system. That may be a great distance that we're connecting with through technology, who help deliver care coordination, transition to care management, medication adherence monitoring, all kinds of services to our patients. And as we drill more closely into our setting, what about our community? The pharmacist down the street who the patient goes to pick up their medications and their role on the team. The home health care nurse who might be involved in the care of a given patient. The inpatient teams that patients interact with when they go in and out of the hospital. All of these and many more people are part of the team. The care coordination function being particularly important, and that team member being either embedded in our office, if we tend to be in a larger setting, or off-site, but connected as a member of the team with the patient and their caregiver families, with the other team members every single day, integrated into that team delivery process. So instituting team is as much about who is on the team as it is about defining what role each person has. And it's generally safe to say that in a team-based healthcare world, the provider of care, the physician, the PA, the nurse practitioner, we're going to be the captains of the team, if you will. But that doesn't mean we're the champion of each function that the team has to undertake. Identifying champions of given functions within a condition or a disease state and building outbound from that a task grid so that we can define in a checklist process who on the team is doing what, and make sure that each task that we have defined for a given chronic condition, as for instance, gets done, and gets done all the time, every time, with every patient. So that's a fundamental piece of team-based care, defining who's doing what, having a checklist process to make sure it gets done, initialing, signing boxes in a task grid to know that that process, that step has happened, checking it off a list, incredible improvements in quality, in removing variability from a care process, and in measuring and documenting that you're doing the right thing all the time, every time, with every patient. And that's the definition of safety. I mean, that's really what quality improvement is fundamentally about.